If you're passionate about making healthcare better but feel the system needs to change, you'll love this podcast called Heartline: Change-Making in Healthcare. It's hosted by Dr. Andrea Austin, an emergency physician who advocates for physician well-being. On Heartline, Dr. Austin talks with healthcare leaders who are rethinking the status quo, tackling burnout, improving medical education, and shaping a more sustainable future for the profession. Find links to Heartline at healthpodcastnetwork.com/Heartline. That's healthpodcastnetwork.com/Heartline.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Are you ready? Let's picture this. A patient sits across from you, carrying trauma so heavy you can almost see it in the way their shoulders curve inward. You know the script. Multidisciplinary team, referral to a therapist, maybe cognitive behavioral therapy, if they're lucky enough to get an appointment. But you stop, because you've done this before, haven't you? You've made these referrals, followed up weeks later, only to hear, I don't know, it was okay. Or worse, silence. Because they never went at all. I don't want to discount the benefits of therapy, and I know it's helpful for people who go. But for many people, it's not just about finding someone who looks like you or speaks your language, though that matters deeply. It's about the kind of therapy itself, the framework, the very foundation of how we approach healing. And then there's the elephant in the room that makes me shift uncomfortably in my chair, to be honest with you. Spirituality. I'm here in the Pacific Northwest, and I sometimes catch myself lowering my voice when I ask patients about their faith practices. There's this unspoken shame. You believe in God, really? But here's what I know to be true. The people we care for, the communities we design systems for, they need and crave something bigger than themselves. In their communities, they already do it. In their cultures, they do too. Sometimes it's faith. Sometimes it's God. Sometimes it's the stories they've carried since childhood about prophets who faced impossible trials and survived. This brings me to something that stopped me in my tracks when I first discovered it. Islamic Trauma Healing. It's not another Western framework dressed up in cultural clothing, but something genuinely born from community wisdom and validated through rigorous research. Another exercise I'm going to have you walk through. Here's what it looks like. Close your eyes, if it's a safe time to do that. You walk into a mosque on a Thursday evening. The familiar scent of cardamom tea fills the air. You're greeted not by a clinician with a clipboard with intake forms and forms and forms, but by Haroon, someone you knew in the community, someone who fled the same war you did, who understands why you flinch at certain sounds. You sit in a circle, 5, maybe 7 people, all same gender, all carrying their own invisible wounds. The session begins with a dua, a prayer that grounds you in something eternal. Then comes the heart of it, the narrative of Prophet Joseph, who was betrayed by his own brothers, sold into slavery, falsely imprisoned. You've heard this story 100 times since childhood, but tonight it hits differently, because tonight you're not just hearing about Yusuf's trauma, you're understanding your own through this. You hear people who hadn't spoken in weeks or their lifetime about what they've experienced. They begin to share. If Yusuf could forgive his brothers after everything they did, maybe I can forgive too. Each session follows a different prophet's journey. Job's faith during unbearable loss, Yusuf's path through betrayal to reconciliation, Moses overcoming paralyzing fear, Muhammad's resilience through persecutions. Their stories and their mirrors reflecting back your own capacity to heal. And then the shift happens. After the scripture reading comes something Western psychology calls cognitive restructuring, but the participants know it as something else. Those crushing thoughts that trauma leave behind, I'm weak, the world is dangerous, no one can be trusted, get gently examined through the lens of faith. Then comes the dua again, but different this time. For 10 to 15 minutes, participants who couldn't tell their stories to anyone are encouraged to tell them to Allah, step by step, feeling by feeling. No judgment, no forms, just you and the divine. And after all this, the session ends with deep breathing exercises. Mindfulness practices that predate any Western therapeutic technique, grounding traumatized bodies back into the present moment. That's it. Let that sink in. 6 sessions led by trained community members, not PhDs, in a mosque, not a clinic. And it's working as well as our Western interventions, if not better. Then, it's not just about the sessions. The lay leaders trained in this program carry these tools into their daily lives. They use them at kitchen tables and grocery stores, wherever their community gathers and grieves. So where does this leave us? For me, it's a call to humility, like always, to recognize that sometimes the most powerful interventions don't come from our clinics, but from the communities who have found ways to heal. With all of that, here's Haroon, a research coordinator for Islamic Trauma Healing and member of the Afghan community, and Jake Bentley, a clinical psychologist who has led the research in this new way of therapy. Links to the research studies are in the show notes. Here's Haroon and Jake. All right, welcome to the show. Tell me about yourself, Mohammed.
Thank you for having me on the podcast today. My name is Mohammed Haroon Walizadeh, and I am a research study coordinator for the Islamic Trauma Healing. And also, I'm an active member of the Afghan community, as well as working with the Lord Front Community Service Northwest as a mental health counselor, multilingual, mostly working with Afghans who speaks Pashto and Dari, both Afghanistan formal languages.
Awesome. And go ahead. Yep.
Hi, Raj. My name is Jake Bentley. I'm a clinical psychologist here at the University of Washington. Work mostly out of Harborview in the Department of Rehabilitation Medicine, but also get to teach classes in global mental health on Upper Campus. And actually this past quarter was joined by it's a really great addition to our class.
Awesome. So what should I call you both? I'll edit this out. Should I go Jacob and you said Haroon or Mohammed, which is better?
Haroon. I like
Haroon.
both.
Okay.
I like Mohammed and Haroon, but friends and colleagues, they call me Haroon.
Okay.
Yeah. And Jake or Jacob is fine with me.
Great. Thanks for coming on, Haroon and Jake, to talk about Islamic trauma healing. This seemed like such an important topic for me because, at least in my own practice, I've struggled to figure out how to deliver appropriate mental health care for many of my patients, especially ones who have suffered from trauma from either refugees or in their home countries. And we just did a recent episode on female genital mutilation. You name it. People have experienced a lot of trauma. And unfortunately, sometimes I feel limited in what I can do because the standard in Western medicine is often a referral to a therapist for counseling. Again, there's many ways to do this, oversimplifying a little bit, but often when I refer to a therapist, they're going to focus on cognitive behavioral therapy, which is also the standard. Again, there's many different types of therapy. But from the time I refer patients, there's a reluctance to engage in it because of distrust of the whole system. And I think they actually have many members in the community who've gone through it and say it wasn't that helpful. So then they have community perspective wasn't helpful either. So it was ecstatic to find actually a different approach to addressing trauma, specifically in Muslim communities. And this was one of them that was highlighted and had great evidence for. So first question that I have for you, Jacob, is tell me a little bit about what the premise of Islamic trauma healing is and I don't know who actually designed it, but what inspired it to be designed?
Yeah, first off, I just want to also highlight that you're not alone in that struggle to find an effective pathway to providing trauma-informed care to people, particularly interventions that are contextualized to culture. And I know just as a practitioner myself, as psychologists, also really wrestle with so many of those concepts as well, which I do think is part of what is really powerful and interesting about approaches like Islamic trauma healing. I think ITH really grew out of the community. And so it started within the Somali community here in the Seattle area. A member of the community recognized the burden of trauma on mental health and barriers to accessing care, like you were mentioning, that Western models of mental health don't line up with community perspectives on the nature of the problem, what is happening to them, their own experience of their symptoms and how to make sense of those, and then running into frustrations with healthcare systems that might direct them in certain ways that they don't particularly find helpful. And so through that community university practitioner partnership, through lots of iteration, this is what is intended to be a kind of a marriage of evidence-based practices for PTSD that we've been able to see and observe through research from diverse populations around the world, but really positioning those within the community's conceptual framework. And so leveraging those core tenets of Islam to do things like restructure beliefs about the self, the world, and other people that might have been shifted by trauma, and to revisit really hurtful memories that are rooted in trauma through prayer in the presence of Allah and the Islamic tradition.
Amazing. Haroon, when did you first hear about this? And what did you think when you first heard about it?
When I heard about the Islamic trauma healing, because I actually thought that it was the thing that will work in the Afghan community, because I closely work with the Afghan community. I am from a community from the Muslim faith. I know what happened in Afghanistan, how other, we call it Western approaches, stigmatized in the Afghan community. That is when I heard Islamic trauma healing, and it is the program that worked for the Afghan community, because you know that Afghans in the Afghan community, decades of war, displacement, and significant trauma, both collective and individuals. These experiences have left lasting emotional and psychological scars or effects. And for many Afghans, addressing mental health is often, as I said, stigmatized and misunderstood. And Western, or we can say other approaches is often may feel disconnected with their cultural and spiritual values. When I heard about this program, I said, okay, this is the unique program suited to the values and culture and religion of the Afghan people. When there's a question that we want to make a survey that whether this program is working for the Afghan community or not, I had the answer, yes, it is working for the Afghan community.
Yeah, I love that. I'm curious to hear, if you go to your community who's suffering from PTSD, depression, anxiety, whatever it is, and you said, hey, I know what would be helpful. You should go to therapy with a counselor and have one-on-one sessions. If you said that to them, what would their reaction be outside of what we're talking about here? What's their current understanding of it? Would they even consider it?
That is one part. And we had a client that we worked for several weeks with him.
Yeah.
She was not talking, or she was somehow reluctant to share thoughts and ideas. When we started like faith-based counseling, kind of this Islamic trauma healing. Then she started talking to us. She was also thinking, this is the way that I could get healing. And also when the other people in the community, when we were talking about we have like mental health services in our office, somehow reluctant, and for some when I was talking, they were kind of thinking of the receiving or seeking like mental health servicing as a weakness. But when we were talking about when I was explaining the program about the Islamic trauma healing, about the narratives of prophets, du'as, and with that we could encourage people to participate in these programs and groups.
Yeah, I love that. I think two things that really resonate with me is, one, community-based healing. I think we dismiss how important that is because we default to one-on-one intervention. So what does it mean as a community, as a group, to have a shared experience of healing? And the second is defining mental health, because I've heard so many conversations of just convincing people this is depression, because somebody will show up and they have body pain or weakness. They're like, no, you actually have depression. They're like, no, I don't. No, like, you actually do. And you're just like fighting with them to say you are. Instead, just, okay, you're suffering from weakness. You know what? There's actually a lot of people suffering from weakness. Why don't we all sit down and talk about what we're feeling and how we can get better from it rather than having to redefine it. So I think both of them, I really love how you contrasted and the community's perspective. I want to now talk about the quote unquote intervention itself. From my understanding, it's a 6-session lay-led group intervention. That's a one-liner. Mm-hmm. But I would love to hear from you all on what is it and how would you explain it to somebody who's never heard of it?
I can take a first approach at that. Raj and Haroon, please jump in. And I actually want to loop back to something that Haroon was mentioning earlier too, because I do think it gets at the components of the intervention as well. And that is even conceptualizing trauma, that a trauma has occurred and identifying trauma and defining that as a term and then developing an intervention in response to it, even as kind of something at that level, so foundational to a PTSD intervention from a Western framework or something like that, is taking a lot of work to come to common ground. What are we even talking about when we're talking about trauma? What kinds of events do we mean? And oftentimes, Haroon, I know a lot of your work has been talking with people and saying, when we're talking about this program, these are the kinds of experiences, deprivation of human rights or exposure to war and sociopolitical violence and these discrete events. These are the kinds of things that we're talking about and the reactions that we want to try to heal through the power of Islam. And it's an intervention, it's a 6-session lay-led group intervention that meets people where they are. So group sessions, historically, at least in all of the implementations so far in Islamic trauma healing, have happened in a mosque setting where people naturally gather. They're not going to the clinic. They're not showing up at a doctor's office with the task of reporting its symptoms and then having a practitioner respond to that and make a diagnosis and then make a referral. It's community interactions that sort of shaped the streams into Islamic trauma healing. And so what that also means is that there's a high level of engagement from community leaders like Haroon and conversation with religious leaders like imams and sheikhs to really take up mental health topics and have the community define those and then address those through a program like Islamic trauma healing.
Amazing. All right. I want to picture a session of how it goes. So I think we talked a little bit about the why and what it is. So digging even more details, at least that's what I have in my notes here. So the group of people, it's a small group, approximately 5 to 7 same gender members. So important that same gender, which meets the community where they're at. And it's often 2 lay leaders of the same gender who have been trained and they're leading the session. And often in the session itself, there's some time for community building, sharing tea and snacks, and then a spiritual preparation, and then the session happens. Although I don't know exactly how the session transpires, but that's my basic understanding. Haroon, I would love to hear about what does it actually feel like if you're going to explain to a community member, what do you actually do there?
There are 3 core things in these sessions. One is the narratives from prophets, du'as, and supplication, and fostering community engagement, like supporting each other during the sessions. Each session was starting from supplication by a dua by imam or by one of the lay leaders, and after that, talking about the structure of the session, what the session would look like today, and the confidentiality, just to assure the people that all the information that are shared during the sessions will be kept confidential, despite we were not encouraging anyone to share their personal stories, but still confidentiality were discussed during the sessions, that just to make sure that the participant feel safe, because it was one of the challenges that to get participants, because of the confidentiality. They were thinking that before attending the sessions, they were thinking that how their information will be kept and how their information will be processed. Just before the sessions, at the consent sessions, at very pre-sessions, we talked about that. And in each and every sessions, the leaders, the facilitators, they were talking about the confidentiality, just to make sure the informations are kept confidential and nobody share the information out of the group. After that, the narratives of one of the prophets for the first session was Joseph or Joseph. The next one was Ibrahim, Moses, and Muhammad, peace be upon him. In each session, in 6 sessions, we had narratives of one prophet in each session. And then was some reflection, discussions about when the leaders or one of the participants who could read was reading the narratives. And then there were some discussions about the narratives and some questions also from the lay leaders. The questions were also already designed just to, or expanding the questions to others to get the thoughts and ideas of other participants during the sessions. And after that was dua, like for 10 to 15 minutes dua. This dua or supplication was a little bit different at the beginning supplication or ending supplication. In this dua, participants were those who were not able to share their thoughts and ideas with anyone due to not trusting. Just they were encouraging or to share the event or the incident, whatever happened to them, to share that with Allah step by step, adding his feelings and thoughts. And also in the next sessions are talking about forgetting those who harmed the person or was blamed for such incident. And then in next sessions was praising Allah for the tawfiq, for the support he provided to him to forgive the person and for the feeling comfortable. And after dua also was some reflections on dua, how it was looking, how the participants was feeling. Then we had the free session. We had like deep breathing with Allah's name. It was like 5 to 10 minutes, or any other like grounding techniques there. And then the session was like ending with supplication. And at the beginning, I forgot it was like community involvement, having tea, talking about community events or something like that.
That's great. Thanks for that detailed explanation. I think I can really picture it. It seems to be there's a component of connection with each other, some scripture, so thinking about faith directly, some reflection, both in group and individual, and then also mind-body-based work. I think there's secular terms probably for all of them, and you can divorce it from faith. But I do feel like it's encompassed in a faith-based intervention, which is probably why people are willing to trust it and actually do it, compared to if I just say, hey, just do some yoga and maybe your body will feel better, versus build it up to this mind-body exercise so people are willing to do it together. I love it. And I think one detail that I had, which for people probably who are listening probably aren't familiar with it, is that each prophet had maybe a message. So what I have here, I think the sessions could change. Session 1, faith during hard times, which is Prophet Job. Trials build strength, is Prophet Joseph. Overcoming fear, Prophet Moses. So there's a kind of theme that people are taught. Anything else you would add, Jacob, from the intervention itself?
Yeah, I think Haroon really covered the key details. And you're right, it does follow this thematic arc. And I think what is really powerful specifically about the prophet narratives these are stories that people grow up with their whole lives. They've heard them hundreds of times. They feel familiar. It's not a conceptual stretch to engage with those stories. And also, so many of them involve themes of loss, of being forcibly displaced from your home, of having to reconcile all of those things in the presence of something bigger than yourself and like Allah. And and in relationship to other people. And I think that element specifically, the prophet stories, we've heard pretty consistently over time that people really find a sense of meaning and enjoyment of going through those and reflecting on what they mean for their own lives in this very specific trauma-focused way. It allows them to approach things, ideas, emotions, thoughts that maybe otherwise would be overwhelming because these stories are so familiar and they're face valid. Like you can look at the story of Job and see, oh my goodness, like this is a person who has lived through so much and is reconciling that in the context of their faith.
Yeah. There's a component of accessibility for the community member who's in the session. But I think the design of it also is supposed to make it so there's not too much resource allocation, meaning that it's led by a layperson, not someone with a PhD who has studied for 7 years on PTSD and everything. So I think there's an accessibility to that. So I think different papers reviewed it, but what is the training that the layperson go through? And how do you know there's not too much variability? Because I think that's what often people worry about when it's not someone who's quote unquote a professional who's licensed, although we all know there's variability there too. But just you're training a community person. So just what does that look like to train lay people to lead?
Yeah, that's a really important point. And Haroon has been our lead trainer on this project with the Afghan community and can speak to so many elements of that. I'll just say from this standpoint of somebody who's partnering with lots of other people to evaluate an intervention through feasibility and clinical trials and really thinking about fidelity and those kinds of things to ensure quality of services. We've really had to think about balancing how do you train a person really thorough while also making a scalable intervention that communities can take up and that can live independently of expertise. And I don't know that we've gotten to 100%, but there's a few things that colleagues Lori Zollner and Nora Feeney and many other people have thought really hard about this to really focus on the key elements. And so we want to equip community leaders to feel comfortable leading a discussion about difficult topics. And so we devote time during the trainings to really focus on, okay, what are the skills needed to be able to facilitate a conversation in a group? And so the training itself is 2 4-hour training sessions. And much of the training is really focused on that piece of it. We also really, as a manualized intervention, this is the intervention that the manual guides the person step by step. And so we train to the manual session by session. We have fidelity checklists for each one of those sessions so that the person, and if there's a supervisor, as there historically has been a clinical supervisor, that they can look at, okay, did we cover each one of the core elements of this session? Or were there any concerns that came up as part of that? But really training to the manual and then having the manual key contents reflected in a fidelity checklist for each session. And really also devoting a lot of time to normalizing reactions to trauma, that as a destigmatizing effort to really normalize it. There's nothing more human than being physiologically and cognitively and emotionally activated by a threat to yourself or to somebody else. There's just nothing more human than that reaction. And so let's start from that place as opposed to the DSM-5 diagnostic criteria space. And so we really train that in all supporting group leaders as they're preparing to do this. Haroon, what would you say from the group leader perspective, from the trainer perspective?
Jacob, you covered, I can say, most of the parts. Just before, but I heard that we should find like trusted people or those who have heart for healing, or they have knowledge of Quran. I was thinking, okay, how we could get this people. Then partnering with the mosque and Islamic centers and with other resettlement agencies, it was somehow easy for us to get the people who already have like knowledge of Quran, like people like Imam and also some other community leaders. they all have like a knowledge of Quran and heart for healing, working voluntarily for the community. These people who were leading community, they are volunteers to work for the mosque voluntarily on Fridays. Most of the 4 Fridays, I see them. With that, it makes our life easier to train such people. They already have the knowledge. They know the community problems. And just what they need is the structure, how to go to and facilitate the training. Just how to explain the manual, to explain the checklist, how the applications will go, how this application is different with our like collective dua that we are doing, how the narratives of prophets will be discussed, what questions will be asked, how the questions will be asked, how the questions will be expanded to others, how if someone is like emotionally stressed during the session, what to do. Did such things why we just step by step, as Jacob said, it was like 2 days, like 4 hours training for the lay leaders, and it went very well. And we also practiced when like a session, during the session, like one was as his example as a lay leader and the other were like participants, just to make sure they are fully able to facilitate the groups at the mosque-based station.
Yeah, wonderful. One thing that kind of stuck with me with this model is, how do I loop in this? I think there's a formal definition of just professionalization of care, but I think the way I'm using it here is that care can only be received through some kind of exchange of currency or insurance or something like that, which makes it so you don't actually build community knowledge or skills. In that the leaders that you've trained, I'm sure they're using it during their sessions, but I am also guaranteed they're using it in their other life. They're like in a conversation and they know how to do this. Somebody's emotionally reactive. Okay, I learned the skills, so I'm going to use it here. And then it probably taught somebody else. So there's a way of teaching leaders so then they can actually help other community, even outside of the session that you're leading. So it doesn't, I think, hold the skill into a professional arena. So more people have the capacity to help, right? That's amazing. I love this idea of trusted messengers, and I've been exploring that for different communities. And I wonder, Haroon, how you navigate, this is just an interesting problem. And it just, because you're so skilled and you've been doing this work, I'm curious on if somebody comes in and they want to do the work, but they're not the right person, or they think the community trusts them, but they think, for example, therapy is bad. No one should go. No one should do these sessions. Because I feel like there's trust placed on some people who are actually maybe not helping the community heal, not intentionally, because they strongly believe that you have to go to prayer and mosque. All therapy is evil, for example, right? So there's people like that. So how do you navigate the complexity of finding trusted messengers and feeling, okay, they're going to help us with this?
Not only with lay leaders, we have only participants that were saying like negative things about the program because they didn't know about the program. And it is too long for us. We spent months to talk to the community leaders, to the every Friday, going to the mosque, talking to the community, explaining the program. This program is different to the whatever you think about it. There were some people when we were talking about Islamic Trauma Healing at the beginning, even they were asking about the funding of the programs. Who is funding this program? I don't know why it was important for them that using the program. And then after a few discussions that this will be narratives of the program. It will not only normalize the experience, the trauma experience, the people of Afghanistan, but also empower them to cope like daily life. When talking about it, we somehow changed those people. We changed their mind. Some of them were our participants, and at the end of the session, after the sessions, these were the people who were talking about how these groups were beneficial for them. And also they were talking about, there were some demands by those people to expand this program in other mosques and other Islamic centers or even in other cities. Some of them were saying this, okay, all Afghans are not only coming to this mosque, but they are also attending or going to other mosques. is it possible to expand this program to other programs? But the only way was like talking to those people, explaining the program, how this program is important, how this program is important, how this program is aligned with our culture, how this program is aligned with our religious and spiritual values.
I think a key component is also probably you, because I could wonder if Jake went out there and tried to convince people to get involved. I don't think I would have gone for. So I think there's probably some community representation that's probably a minimum threshold. And then you have to build on it of all the reasons people distrust. As you said, that's such a vivid question of who's funding this, like the deep skepticism of what are you actually trying to do here, Haroon?
Yeah. And also encouraging Imam to talk on Fridays. Every Friday, Imam, half an hour, he is talking about the religious things or something from the community for the benefit of the community. I was also encouraging the Imam to talk to the community how important this program is for the community to be implemented and how the community will benefit from this program.
Yeah, I think that's something we've thought a lot about together as a group with Haroon, you leading so much of this about who are the stakeholders in the community and the people of influence. And how can we be in dialogue with those people in different domains? So we talked about health boards and coalitions of Afghans in Washington State and mosque leadership. And as you say, devoting a lot of time up front to not rushing those conversations and developing or strengthening relationships so that they can appreciate and understand where this program's positioned and the intentions of it. And people, even still, rightfully and understandably had concerns, including on the research side of things, like who's asking these questions and why, and is a government entity going to have access to my information, and what is that going to mean for my asylum claim or some other question that might be hanging out there? And there's a lot of that upfront legwork that you did to make all of this possible, to make people feel comfortable or developing that comfort level.
Yeah. And we had the client that he just signed the consent form and he said that he will not attend, and he is fully aware of this program. I talked like about more than an hour with him, and then he said, okay, I will sign the form and attend the program. I said, no, Estelle, the program is still next week. This is my number. If you have any question about the program, if you need more details about the program, just feel comfortable. If you feel comfortable that this program will be beneficial for you, you're most welcome to attend. If not, Estelle, I will be there to support. If this program is not working, we have like other programs like at Lotron or other programs. If you think that those programs are beneficial for you, we can take you there. But that guy attended that program after getting information about the program.
Yeah. Thank you. The next big question is, does it work? I think that was what the research studies were on. So how did it go?
It has two parts. One, we are still waiting for the result, the data to be analyzed. What the data went to what the people, because it was the survey, whether the questionnaire the people answered. But we don't still have that data finalized. And the other thing is being in the community, because I attended all the session from A to Z. The community feedback, the participants' feedback, it totally worked for them. It worked for them because before the sessions, when I was talking, they were complaining about like difficulties of life, symptoms of, there were some symptoms of PTSD or some other things they were talking about. And at the end of the sessions, when we are talking, okay, how are you? They were saying, okay, we rely on Allah, everything will come, everything will be changed. Even the prophets faced these immense trials, and they somehow overcame with like faith, resilience, patience, these things. We will also reach out, same things. These days will be changed. These feedbacks, when you hear feedbacks, you can say that it totally worked for the community. And last night I was translating the transcript of the videos and audios from the women group. Out of 10, 9 was positive. And the last one was also positive, only there was some saying about the limitation of resources. Though we have like intensive for transportation, she was saying that it was not enough to get Uber with that intensive. But it was, with that, I can say like 100% positive feedback from the lay leaders and from the participants, from women and from men, and also who did not attend, and these people who attended the sessions, and then because they are the people from the community, they went back to the community. They talked about the program, how this program was designed, what happened during this program. Somehow it was helping reducing stigma in the Afghan community, those who were reluctant, those who are hesitating, participating the sessions. Now they are ready. When I go to the mosque, last week when I go to the mosque, I was asked by some people when the next group will be started. It means that program worked well, that people are happy or just waiting when the next program will be started.
I love that. I think the component that resonates with me is if we're trying to not be too academic, there's the question of answering the question. Answering, does it work? One is very academic of research studies. The other is what you're saying, Haroon. It's almost just normal people living a life. If you go to a movie and you liked it, you're going to tell other people. In that, what's good because you're actually telling other people and promoting it. They have marketing as scores for that. So just the idea of, I'm not just lying to Haroon because I want to get out of here, but I'm telling everybody, it's like, actually, you should go do this thing. And as you said, it's decreasing stigma, which is all incredible. Jake, I know you were going to mention it, but there was already studies released. I know there's probably more data. I think there's 2 pilots and 1 RCT that did show some gains, right?
Yeah. So we've done 2 pilot studies in the Somali community previously, one in the local Seattle area, where we also conducted a larger randomized controlled trial. That trial also included a community in Columbus, Ohio, where they have a sizable Somali community there as well. So it's a 2-site domestic randomized controlled trial. And then we have a feasibility study in Somaliland as well. And what we find so far across all of those different studies, the feasibility trials are really answering the question on the front end of, is this possible? Do people like it? Does it seem to show reduction in distress? And for both here in the US and in Somaliland, really clear results showing a significant pre-post reduction in symptoms of PTSD and depression and anxiety, improvements in subjective quality of life, and improvements in daily functioning. People describing just feeling like they have more capacity to do the things that they needed to do. And so that's all on survey data, but also focus group data reflects exactly the kind of feedback that we were just hearing on the Afghan pilot, that participants reflected that it was a program that was consistent with their faith perspective, that it met community needs, that they would be interested in telling other people about it. So we've heard those common messages. And on the US-based randomized controlled trial, where we had a little bit less than 100 participants enrolled in that trial. So it wasn't a huge trial, but we found, for the academics out there, people who were interested in clinical trials, we found effect sizes, statistical effect sizes that were comparable to professionally delivered PTSD interventions, the gold standard evidence-based practices for PTSD that are routinely delivered in major health systems in the US. This lay-led intervention was showing effect sizes that were pretty comparable to those interventions, which was, I don't know that we fully anticipated, but it was really encouraging in terms of being able to grow this program to benefit more people.
It's great. Backtracking maybe a little bit, because I'm thinking of a little bit of future application and adaptation to maybe different communities or different sources of trauma. You said it was designed by the community, although I'm unclear on how that came about. So let's say I work with the Pacific Islander community and they have their own trauma and barriers. What would it mean for them to design it? Because I think there's also a hopelessness that is sometimes within a community who's suffered from trauma. So I'm curious on how you went about even designing a program like this, and maybe that'll link to like how could we adapt it to other communities?
Yeah. So the Islamic Trauma Healing really came from the community in the sense that it took community leaders identifying that trauma was a barrier in the community and communicating, reaching out to a colleague of mine here at the University of Washington, Lori Zollner, who is a trauma expert, the internationally known PTSD intervention researcher specifically. And so Lori, working with this community leader, it took months and really years to develop the structures for this intervention. And that's where sort of the marriage of, as someone who, Lori, growing up academically and the prolonged exposure intervention kind of thread, working directly with Edna Foa, who developed prolonged exposure, taking that expertise, but positioning some of the key ingredients within the community perspective through lots of dialogue was qualitatively how this all came to be. And I'll also say it's funny to think about how things evolve in communities too, because back in about 2007, 2008, as a graduate student, I was working as a research study coordinator for Ethnomed, which is a web-based resource here at the University of Washington for healthcare. I know you've had folks from Ethnomed on before, but for people who may be listening that aren't familiar with Ethnomed, it's a resource for healthcare providers to understand perspectives of communities around different topics. And sometime around 2007, 2008, I was tasked with meeting with various refugee communities to talk about perspectives on distress and healing and how people move through different life stressors. And one of those communities was the Somali community. And at that time, which sort of predated the development of ITH, the themes that we've all been talking about here around faith and trauma and healing really came through so clearly in that dialogue. And then just a couple of years later, this is when the program started being developed. For adaptation, So I guess to get back to your questions, for adaptation, I don't know. I don't fully know the answer. I think what we have thought a lot about in doing this work is what are the common factors, and then what's the context around those common factors from a mental health perspective, and then what is the context that gets all wrapped up around those common factors. And so in this case, we thought a lot about those shifting beliefs about the self, the world, and other people that occurs after a trauma happens. Thoughts like, am I strong enough? Or the world is unsafe, or people are out to get me, or whatever those kinds of thoughts and beliefs are as drivers of distress, because it's been demonstrated and replicated over and over again. And then also the trauma-related avoidance piece, that people naturally withdraw from those things that remind them of the most hurtful or stressful events in their lives. But we also know that avoidance prevents other kinds of learning, that, oh no, not all situations are dangerous. And so how do we help people reconcile those negative beliefs within themselves? And then how do we help people move through avoidance? And then constructing a response to those mechanisms in a way that engages with all of the culture and context and language and access kinds of considerations there. But the form that all of that could take, the form that addressing the negative beliefs or the avoidance could take, is really fully dependent upon all of that context that's wrapped up around it. And so it's a really complicated thing to think about, but that's what we've, I think, tried to do here.
Yeah, that's, I think, really interesting. I think of what is the current knowledge we have about mental health, how it's applied, and how do you adapt it? And I think you talked about it in detail, which hopefully is helpful for some folks. The the next question is, how can people sign up? Like, when is this going to spread? And what does accessibility for this look like? Because I'm sure people are going to listen to this and say, hey, I know people who could benefit from this. We just call Haroon and say, can we join?
Yeah, we're providing Haroon's personal phone number. It's fucking yeah, it's a good question. So we just completed this pilot study on the research side of things with in partnership with the Afghan community. Just finished it up, and so I think from a dissemination perspective, we want to make sure that it's good and helpful, and we think that it is. We want to get into the data more to better understand that. And the intent with Islamic Trauma Healing all along has been that if it's helpful and obviously non-harmful and benefits people's health, that we want it living out there in the world. And so it's a train the trainer model. People from the community can train other people to be group leaders, and people could start their own groups, and all they need is a manual to be able to do so much of this. And so the broader vision is that if this is good and useful, that it eventually will be out there living in communities, and communities can decide for themselves whether it's something they want to take up in the long run. Locally here, Haroon, we got to figure that out, how to keep people engaged.
Yeah. Awesome.
Yeah, people are participants and lay leaders and community members are also waiting for the summary to be shared with them. And also one thing about this program, as you've mentioned before, Raj, there are some demands from the community leaders. They said that, okay, even this program is funded or not by UW or Lotron, we would try to implement this program at the mosque setting. Or also from the Kabul, Washington, they were asking a copy of the manual if they can use it to run this program in Kabul, Washington, or like other Islamic centers. And also during the sessions, even I was asked, because we found this program very helpful, because the people of Afghanistan, inside Afghanistan, with the current situation, they are traumatized from the previous or currently the situation, particularly for the women, for the girls, and for the women in Afghanistan. Will it be possible to have to implement such programs in Afghanistan? Because as we all talk about stigma around mental health, and people think that this program will not be useful for the people in the United States or abroad for the Afghans, but it can also be helpful for the people inside Afghanistan.
That's great. Any final thoughts?
Haroon, any final thoughts from you? Raj, I just appreciate your interests in this work, and hope that people find it interesting as well. And I welcome any contacts if people want to reach out and learn more.
Thank you.
Thank you for having us on the podcast today. And I hope this program is also part of the healing for the Afghan community and reduces stigma and improve awareness around mental health in the Afghan and other communities.
Yeah, I appreciate both of you. Part of this work, it is about Islamic trauma healing specifically, but also continuing to get people to imagine what culturally adapted frameworks can look like and still achieve outcomes they care about, but also what the community cares about. Because we can get lost in the language a bit of trauma-informed care, cultural humility. People just say that over. You're like, what are you talking about? To actually have this piece, which is led by the community, and there's evidence, but also good response from the participants as well. So I think it's just great to hear that. So I really appreciate you all doing this work too.
Thank you so much.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.